Tonight's second bedtime lesson is about epilepsy. Epilepsy is a condition that affects the brain and is defined by repeated seizures. Epilepsy affects more than 600,000 people in the UK. Almost 1 in every 100 people has the condition. Symptoms. The main symptoms of epilepsy are repeated seizures. There are different types of seizure, depending on which part of the brain it affects. The cells in the brain, also known as neurons, conduct electrical signals. They communicate with each other in the brain using chemical messengers. During a seizure, there are abnormal bursts of neurons firing off electrical impulses. This can cause the body and brain to behave strangely. The severity of seizures can differ from person to person. Some people experience an odd feeling with no loss of awareness, or may have a trance-like state for a few seconds or minutes. Others lose consciousness and have convulsions, uncontrollable shaking of the body. Some people might only have a single seizure. If they do not have a high risk of having further ones, they would not be regarded as having epilepsy. What to do if someone has one? If you see someone having a seizure, there are some things you can do to help. It will not usually be necessary to call an ambulance after one. If you're with someone who has one, protect them from injury by removing any dangerous or potentially harmful objects nearby. Cushion their head with your hands or soft material. Do not restrain them or attempt to move them unless they're in immediate danger. Do not put anything in their mouth, and stay calm and stay with them until they regain consciousness. When the convulsions have stopped, put them into recovery position until they're recovered. Status epilepticus. Status epilepticus is the name for any seizure that lasts longer than 5 minutes, or a series of seizures where the person does not regain consciousness in between. This is a medical emergency and requires treatment as soon as possible. You can be trained to treat status epilepticus if you care for someone with epilepsy. It's important to phone 999 for an ambulance immediately if you suspect status epilepticus. If you've been trained to treat the condition, you will usually have been advised to use either a medication called buccal midazolam that comes in liquid form and is given by trickling the liquid onto the inside of a person's cheek or up their nose. This is the most common immediate treatment. A medication called diazepam that is placed in the person's rectum, less commonly used. If you've tried one of these treatments and the seizures are continuing, phone 999 for an ambulance. Types of seizures. People with epilepsy can experience any type of seizure, although most people have a consistent pattern of symptoms. Seizures can occur when you're awake or asleep. The type of seizure depends on how much of the brain it affects. There are 2 of them. Focal or partial seizures, which means where only a small part of the brain is affected, or generalized seizures, where most of or all of the brain is affected. There are 2 types of focal seizure: focal aware seizures and focal impaired awareness seizures. And there are 6 main types of generalized seizure: absences, myoclonic seizures, clonic seizures, atonic seizures, tonic seizures, and tonic-clonic seizures. Myoclonic, tonic-clonic seizures and myoclonic atonic are seizures involving a combination of the generalized seizures above. Causes of them. In some cases of epilepsy, a cause cannot be found. If there is an identifiable cause, it usually involves the brain being affected by a condition. The brain is a delicate mix of nerve cells, electrical impulses, and chemicals, known as neurotransmitters. Any damage has the potential to disrupt the workings of the brain and cause them. The categories of epilepsy can be separated by the causes, which might be structural, genetic, infectious, metabolic, immune, and unknown. Seizure triggers. For many people with epilepsy, seizures can occur without any obvious trigger. However, certain circumstances or the use of certain substances can cause them before a seizure. These include stress, lack of sleep, withdrawal from alcohol following heavy drinking, some medications, legal drugs, your menstrual cycle or period, and flashing lights. This is an uncommon trigger that affects less than 5% of people with epilepsy and is known as photosensitive epilepsy. Keeping a seizure diary is a good way to help find out what might trigger your seizures. Every time you have one, record it and make a note of what you were doing. Over time, you might notice some avoidable things that seem to trigger your symptoms. Diagnosing epilepsy. Yeah, I think this will be the second to last one. Epilepsy is usually difficult to diagnose quickly. In most cases, it cannot be confirmed until you have had more than one seizure. It can be difficult to diagnose because of many other conditions, like fainting, migraines, and panic attacks can cause similar symptoms. If you've had one, you'll be referred to a specialist in epilepsy. This will normally be a neurologist, a doctor who specializes in conditions affecting the brain and nervous system. Describing ones. Some of the most important pieces of information needed to diagnose are the details about them. The doctor will ask you what you can remember and any symptoms you may have before it happened. Things like feeling strange before the seizure or experiencing any warning signs. It is extremely useful to talk to anyone who's seen your seizure and ask them exactly what they saw, especially if you cannot remember. The doctor will also ask you about your medical and personal history. They'll ask whether you've seen any medicines, drugs, or alcohol. The doctor may be able to make a diagnosis of epilepsy from the information you give. They may run further tests like an electroencephalogram or magnetic resonance imaging or an MRI scan. Even if these tests don't show anything, it's still possible that you have epilepsy based on your symptoms and description of your seizure. Treating them. Most people with epilepsy can be successfully treated with an anti-seizure medication. They do not cure epilepsy, but can prevent them from occurring. There are many different ones. They work by changing the levels of the chemicals in your brain that conduct electrical impulses. This reduces the chance of one. The type of ASM recommended for you will depend on a number of factors, like the type of seizures you have, your age, whether there are any concerns about an ASM interacting with other medications like the contraceptive pill, or whether you're thinking of having a baby. Examples of common uses ASM include sodium valproate, carbamazepine, lamotrigine, and levetiracetam. And finally, alternative procedures. Your doctor may suggest an alternative procedure if your epilepsy is still poorly controlled after trying treating the ASMs and brain surgery is not suitable for you. This may be vagus nerve stimulation or VNS. Time for our bedtime bird.